Hi, this is Josh, Dream Body Clinic, and I am here with returning patient Roland. And Roland, you were here last year, and you came for, your main condition is spastic paraplegia, correct?
Correct.
All right, so I guess, let's just start with that. You came for spastic paraplegia. I don't know if you want to give a quick breakdown even what that is. And
Spastic paraplegia is a fairly rare neuromuscular disorder. And people who have spastic paraplegia have a defect or a mutation in the SPAST gene, S-P-A-S-T, which controls the upper motor neuron function in the brain and the spinal cord. It's a fairly rare, the incident rate for that particular disorder is 3 in 100,000.
Jeez.
There are, and it gets more complicated than that because there are 80 recognized variations of that one disorder. I have variation number 4, which we call SPG4, which is the most common of the 80.
Got it. And so you had seen a video we'd done in the past with a patient named Kathy, who also has this, and it's worked really well for her. So you decided to come down, give it a shot, and now you're back, and you brought your son also, because I guess it is hereditary, right?
Yes.
So that's kind of the tough
it's
part.
Hereditary. Most of the people who get it are passed on hereditarily. In my particular case, I mutated or whatever when I was an embryo in my mother's womb, so I didn't inherit it. But unfortunately, I passed it on to my son, and he did inherit it.
Got it. All right. So, when did you first notice the symptoms and when this was happening?
Both my son and I have what we call adult onset spastic paraplegia. They have some that you can inherit it as soon as a year of age as a child. But both my son and I have adult onset. I first started noticing it about age 38. My son noticed his about age 40. And when I was 38, I started dragging my feet, had a little dragging my feet when I was walking. And so I tried to figure out what it was, what I could do to fix it or whatever. And it took me I went to bazillion doctors, had lots and lots of a wide range of tests done. And finally in the 10th year, there was a doctor at the University of Mississippi Medical School, Dr. S.H. Subramoni. And I got an appointment with him, and he ran 7 tests on me. And at the end of the day, he said, "You have spastic paraplegia." It was about another 4 years before I had a DNA test, because at that time, DNA tests were kind of new and evolving. But I had a DNA test 4 years later, and he was spot on. It was spastic paraplegia, and I had actually variation number 4. And so there wasn't any sort of cure, or there weren't any treatments for it.
So what did they do for you? They just told you what you have and sent you home?
Dr. Subramoni, they gave me a medicine, baclofen, which they use for multiple sclerosis. And it's like you take the medicine, it's like you have a halo. You feel like your brain has this little thing spinning around. But it didn't improve my walking, and essentially my particular one is the legs. I have a lot of trouble walking, a lot of trouble moving my legs. They have some variations of spastic paraplegia that also involve the arms. But luckily I was able to miss that.
All right. And so then you came last year, and was it just the intrathecal?
Just the intrathecal.
And so that's where we go into the spinal cord fluid, and we put the stem cells there, put in 50 million mesenchymal stem cells, allows them to go up the spinal cord, affect any nerves there, regenerate, and then get to the brain, where, the hope is we can help neurogenesis, neovascularization, help with the immune system, and get things going. So how did it work for you? What did you see?
I'm going to go over what I consider the 8. I've listed 8 most consequential things.
Okay.
The first one, whenever I came, I had virtually no feeling below my knee. I woke up a lot of times, or took my pants off a lot of times at night, and I would have scratches, cuts, bruises.
Oh man.
And I never knew how they got there. There were cuts and bruises and scratches on there. The morning after my treatment, I woke up and I could feel the sheets on my legs.
Wow.
It was like really amazing. It was like being blind and then waking up and all of a sudden you could see. It was a big deal for me. Another thing I want to talk about is my toes. My toes my toes were trying to grip the floor, so they had actually curled under.
Oh, okay.
And 2 months after treatment, they uncurled and they remain that way today.
Oh, wow. That's really cool.
And I'll still have my feeling in the legs. Number 3, essentially what happens with spastic paraplegia is the brain gives the muscles, or it decides it wants to move a group of muscles. And so it sends a signal to the upper motor neurons. Upper motor neurons are supposed to do 2 things. Number 1, they're supposed to send the signal to the motor neurons in the legs, or the leg muscles, or whichever muscles. And then they're supposed to send a feedback signal back to the brain that says, I did what you told me to do. In spastic paraplegia, the upper motor neurons do not always, or do not send back a feedback signal. And so the brain, thinking that it didn't send the signal, sends more signals. So essentially it overloads. And before the treatment, my legs, my calf muscles and my thigh muscles and my calf muscles were always taut. It was like I'd run a 25-mile marathon. They were like hard.
Wow.
And so whenever I would try to, at night, I had to pretty much, I couldn't bend my knees.
Nope.
So I had to sleep straight out. Within 2 months, my muscles relaxed and I could bend. And so most of the time I sleep I sleep all night with my legs bent.
Oh, okay. Yeah, I forgot what number we're on too.
The next one had to do with driving. For the past 5 years, my wife has had to be the primary driver in my family, in our family.
Okay.
And the reason for that was that I couldn't feel, again, the sensation thing. I couldn't feel the pedals.
Oh.
So they were down there, and I had a lot of trouble moving my leg back and forth between the gas and the brake pedal.
Okay.
About 2 months after I got back, all of a sudden I could feel the feeling in my left leg. I could feel the brake pedals and everything, and I had gained enough access so I could move back and forth. It used to be that I would have to steer with my left hand and use my right hand to guide it back and forth.
Okay.
And now my legs do what they're supposed to do.
That's awesome.
Okay, the 6th thing had to do with balance. I still have trouble whenever I had a lot of trouble before I came with balance, standing up, holding still, moving. Now I still have some trouble if I'm walking. If my legs are moving, then I have a lot of trouble. But if I'm just standing still, I can move my arms, I can move my torso, I can do everything, and I have perfect balance. And my biggest problem, again, is the walking. And before the treatment, and even a little bit now, my tendency was I have my feet would tend to turn out. Instead of walking like so, my feet would do it like this. And I end up doing what they call scissor walks, or what my wife calls scissor walk. And it makes it kind of, since you're doing and you're sort of stepping on each other, it makes a lot. Since my treatment, I've gotten a lot better. I'm more tending to keep it straight. It's a lot of improvement. That this is still the one that I need to work on the most.
Okay.
And then the last one is what I call my runaway moments. Before the treatment, and a runaway moment, I would be in the store, I would be pushing a cart, and somehow a switch would click on. And this was even before the treatment.
Okay.
And I could just push the cart, I could almost run with it. And of course, it pissed my wife off a couple of times because I would run off. I'd be so excited that I could run that I would
take advantage of it.
I would take advantage of it. And I called them my runaway moments because I would kind of run away from my wife or wherever it was. Before the treatment, I would have one of these. I had these before the treatment.
Okay.
But I would only have like maybe 1 or maybe 2 in a year's time.
Oh, wow.
After the treatment, I have 1 to 3 treatments a month, which is like almost a 12
Runaway movement, or
and in fact, I had one last Saturday. We were in the store, and all of a sudden, I just started going. But my wife caught me and said, "Well, I need you to look at this." And by the time they would only last for about 5 or 6 moments, so this is
Okay.
you know. But for somebody like me, 5 or 6 minutes is
great.
it's pretty impressive. But my one last Saturday was kind of short because I had to go through and look and see what my wife wanted to show me.
Okay. So that's all of them. So I guess my next question then is, like, this is a genetic condition.
Yes.
Stem cells cannot change genetics, right? So, but we can help with the symptoms. So it's been a year. Like, have you seen the disease regress? Are you seeing any of these things coming back? Or has it felt like, you're here again because you just want to keep that momentum going?
Everything worked for me real good up through about the 9th month. Like I say, it's been 12 months since I had a treatment or thereabouts.
Yeah, almost exactly.
And it worked real good up till about the 9th, and then it sort of tapered off.
Got it.
I haven't really lost anything. I'm not where I want to be.
Okay.
I mean,
So it didn't feel any more
here,
progress. It kind of felt like it was progressing and then just stopped at 9 months?
it sort of stopped, if it progressed very, very slowly.
And that would make sense because usually around 8 months to a year after the cells start to differentiate, your immune system wipes them out. So they're just not there anymore to do anything. So that's interesting.
But at the same time, like I say, I still have the feeling in my legs.
Okay.
All of the things that I had, they maybe didn't do it as well, but I didn't lose all the things that I gained.
Good.
And my hope was, I brought my son with me. We just found out that he has it. So he's where I was 30 years ago. He has a slight foot drag. And we're hoping if it did all of this for me, then it would also help him, or maybe eliminate or stop his progression altogether. And I really hope, or I think, in my opinion, I've had this for 30 years. I think this first treatment maybe brought me back 10 years. So I still have 20 years of stuff to overcome.
Yeah.
But it may take me 4 or 5 treatments or whatever, but a little bit of progress is better than no progress at all, at least for me.
It totally makes sense to me. Well, wow, Roland, thank you so much for sharing that. Hopefully this will help some other people out there, similar condition. It's a pretty rare thing, but I mean, there are people out there with it. So if you have this condition, if you're interested, you want to learn more, you can check us out at www.dreambody.clinic. You can call toll-free anytime, free consultation at 833-445-9089. I'm Josh. Happy to help.